what do you want to talk about today?
I guess anxiety. Um, I have I forget what you call it, anxiety. Not attacks, but I have anxiety stuff, problems, whatever you would call that.
Disorder?
Yeah.
An anxiety disorder?
Yes, thank you. And I don't know what to say about it, but I guess one of the things that bothers me about it is that I have read about it and kind of studied about it, so I know what it is and what to do about it or whatever, you know. And a lot of the main symptoms of it I don't have. I have some symptoms of it, but so it makes me wonder if it's really anxiety or if it's something else or whatever.
So you're unsure about whether it's anxiety or possibly maybe something medical that could be going on with you when you're feeling this way?
Yep. And I don't have the racing heart or pounding heart. I have chest pain, but not racing or pounding heart. And sometimes if I will have anxiety attacks or something every now and then, where you have those kinds of symptoms or whatever, but on a daily basis, it's not that. I still have symptoms of something that would be anxiety, I guess. But the main symptoms that I always see if I read about it or whatever, I don't have it. I just have the chest pain, and I don't have shortness of breath usually, and sometimes have just a nervous feeling or whatever. But the main thing is just the chest pain. And I have been to the doctor, and they did all try having an anxiety attack, I guess, and went to the doctor, and my blood pressure was way up, so they did a bunch of tests to determine, checking my heart, did a stress test and a bunch of other stuff, and they said I wasn't having a heart attack, but they didn't really say what it was.
So your anxiety causes you anxiety about that it could be that you're having a heart attack or something else might be going on that's going undiagnosed because everybody just assumes it is anxiety instead of that it could possibly be something else.
Right. Because as soon as I mention something about it, they automatically just go with anxiety or whatever.
Mm-hmm.
They don't really seem like they pick up on the details of what is not or that is different. And I realize everybody has different symptoms and that can be different, but it just seems like they're unanswered questions.
So, you possibly feeling concerned that this affects you day to day, your anxiety symptoms? Do they affect you in your daily life?
They can. I try to ignore it as much as I can, just because I don't want it to affect my daily life or affect anything. But sometimes you just can't ignore things. I have those little chest pains and stuff almost every day, throughout the day.
So you're finding it hard to ignore the chest pains and stuff because they're there daily and affecting you and of course, they bring back your anxiety and make you feel like there's something else going on besides just the anxiety.
Yeah. And yeah, I don't know.
So you've been to the doctor, and the doctor is, they've checked your heart, they've checked everything that it could possibly be physically, and there's nothing there, correct?
I'm assuming there was nothing there. When they released me from the hospital, when they did all those tests, the doctor never came and talked to me. They just released me. They didn't say anything.
So that troubles you that they never gave you a final say-so from the doctor, but possibly the doctor gave his opinion to the nurses there at the hospital
Might have.
to release you. He discharged you.
Yeah.
So
And they, all the nurse said when they released me was that I wasn't having a heart attack, and that I needed to get my blood pressure under control through my regular doctor. And when they had me on a nitro patch to keep my blood pressure normal, and when they released me, they just took the patch off and said, "Go see your doctor," and my blood pressure was going back up as I was walking out, or before they actually released me. So that whole event was just kind of weird that they just did it that way. But back to the anxiety problem, you know. When the anxiety is bad, there has been the last couple of days or so that they had the chest pains and stuff, and pressure is not really the right word, but the lack of pressure, whatever, in your chest, that just kind of, for me, it is, if I'm sitting in a chair, I'm just kind of arching back, trying to make it go away.
Yeah.
I don't know, just a way to make it. I don't know if that is anything or not. Probably doesn't, but something. Just it's not really pain. It's just a real uncomfortable feeling, and then you have a little bit of pain with it, but.
So far you've been to the doctor, you've tried some, you were talking about your positioning of yourself, so you've tried some things to help you relax at home, some different positions, and maybe have you tried some deep breathing or meditation or anything that could bring your anxiety down, changing of your behaviors?
Kinda. I don't know if I call it, wasn't really intentionally doing deep breathing or whatever, but when it's real bad like that, you know, you're trying to take deep breaths to try to make it calm down or whatever, to make it better, and it usually just makes it worse.
So you feel worse when you take the deep breaths.
Yeah. And I was seeing I think she was a nurse practitioner underneath psychologist or whatever at the VA, and she had tried giving me different stuff to control the anxiety. But one of them, she said, if you're having anxiety, this is not going to allow you to have an anxiety attack, because it won't let your heart rate go up, whatever, to allow you to have an anxiety attack. But my heart rate doesn't go up when I have those problems. It just has the chest pain and pressure and stuff like that. So it didn't work.
Yeah. So you've tried medication. You've tried helping yourself by doing some stuff at home. You've tried, you've seen your doctor, and it's not physical, medical. So
Oh,
what is the next step that,
I don't know. That's what I'm trying to figure out. The only medication that seems to work, I don't like taking because it's supposed to be really addictive, and that's Xanax. But I don't take it on a daily basis. I just take it when it's one of the really bad ones, and it just won't go away. And that's the only time I take that, because I don't want it to be.
right?
I don't want to get addicted to something. But that's the only thing that seems to work. But the VA, they won't give me that. I have to go
Right.
to a civilian doctor to get that.
So you're frustrated because what it seems like will work, or what does work, is addictive, and you don't really want to take it, and the doctors don't really want to prescribe it for you. So you
Good.
feel kind of stuck where you are and what you're doing. So,
Yeah.
well, hopefully things will get better for you. We can keep talking this through and come up with some goals and stuff for you. So I look forward to working with you.
Thank you.
Oopsie. Ta-da.